Volume navigation with needle tracking can be an excellent tool to use during procedures. It's important to understand all the components and proper setup prior to performing this procedure and understand how to do this within a sterile environment. I'm going to walk you through all the components and attach everything to the system in an order that we would do during a normal setup. First off, we have a transmitter here, and this would go alongside the patient on a stand. Needs to be about 15 to 18 inches from the area that we would be doing our procedure with. The other pieces we have now is we have sensors that will attach to a bracket on the transducer. These sensors, along with this transmitter, allows the ultrasound system to always know where the transducer is at any given time. The other piece of this will be the sensor itself for needle tracking. This sensor will fit inside a coaxial needle system with a sensor tip at the end of the needle, which will allow us to know where the needle tip is at all times during the procedure. I'm now going to walk you through the setup. For this particular exam, I'm going to use the 9L transducer, so I make sure that I pick up the bracket that's labeled 9L, so they're both the same. This will snap on the transducer. You'll notice there's a small circle on one side, which will correspond to the circle on one side of the bracket, and that will clip right on. The next part of the setup is going to be the sensors themselves. As you'll see on the sensors, there's two sensors and there's two plugs. One side of each has a pink ribbon. You want to make sure the port that you plug the pink ribbon into is the same one that you connect to the bracket. For the purpose of consistency, I always plug the number one spot with the pink ribbon. I'm just going to plug it into the bottom of the system. Now on the transducer itself, we're going to see a label 1 and a label 2 on the brackets. So I'm going to plug the number 1 with the pink ribbon and the other one blank on the number 2 spot. In order to secure the cable in place, I'm just going to use these small clips. To finish getting ready for our sterile procedure, we can then apply a drape to our transducer. For this purpose, I'm going to use one with a guide as well. So inside the kit, I'm going to find my sterile drape as well as my guide. In order to apply the drape to my transducer, I'm just going to put some ultrasound gel on the end of my transducer. And place it into the drape. Now, as you'll notice here, I'm not fully in sterile gloves, so in a traditional procedure, you'd want to make sure you're dressed appropriately for a sterile procedure. I'm now just going to apply the rubber band on here to hold this in place. And again, as I mentioned, I'm using a particular guide for this one. The Ultra Pro E guide just snaps right here on the outside. This is an excellent guide to help me stay within the ultrasound beam, but give me full flexibility to come in at any angle. I'm just going to place this back on the system to continue setting up. Now that our transducer is set, we're all ready to prepare our E-Trex needle system. The E-Trex needle system comes in a sterile kit. In the kit, you'll find a sterile drape that will cover the cable for the sensor itself, as well as the needle. The needle is a two-part needle system, so it's a coaxial needle system. So it's an outer sheath and an inner stylet. The inner stylet is where the sensor will be placed into, which allows the sensor to be reusable. I'm just going to demonstrate for you how we would set this up for a procedure. The sensor will be fed right into the cover. And I would be in sterile gloves to be able to prepare for my procedure. I would then be able to take the sensor and place it inside the E-Trex needle system, and it would clip in place. Now I would be all prepared to be able to start my procedure.